So,
observing a patient's skin color by checking if there are any presentations, rashes, or even muscle masses. If in any instances that these are present aside from the skin color, then that's palpate. For skin color, it may be from erythema, jaundice, or others. Okay, so I was able to observe that the skin color is normal, indicating no abnormalities and no lesions, muscle masses, or rashes present. So now, let's proceed to the second step, which is to palpate the patient's radial and brachial artery.
now we'll start assessing the
The
cardiovascular
radial
system.
artery will be
First is to
located
inspect
just
the
in the wrist, under the palm of
inspect
the
and
hand.
palpate the cardiac arteries. So palpate one cardiac artery at a time so that it will prevent the decrease of blood flow. After this, we're going to concentrate. We're going to use the belt part of the belt part of the stethoscope to hear the low pitch sound of the artery. We're going to look for if there are any.
Now I was able to detect the pulses from the radial and brachial artery. Let's proceed to now assessing the lower extremities. We're gonna be
After that, after us completing, we're going to inspect the neck for any
assessing the patient's lower extremities
So why do we
by
need to look for the
observing the patient's
I'm looking, we're
foot
going to
and
look for
toe
those
skin color
that
by
is more
checking if there are any present
or
lesions and
more
muscle masses.
4 centimeters or more. This is an indication of any
Ask the
underlying
patient to please
inspect.
lay down.
After that, is we're going to inspect the precordium for contour, pulsation, and hues. For health, we're going to observe that's actually the lifting of the chest wall, pulsation, and then the consort. And
The
then
patient
we're
has
going
still
to observe
normal skin
the
color.
observe and palpate the
I
fourth
was
and
not
fifth
able to
intercostal space
detect
for
any
its
lesions
apical
present
wall.
or any muscle masses. So now, let's proceed to testing for the pitting edema of the patient. Now, to give you a background of pitting edema, the pitting edema has all grades.
After checking, as we're now going to use the 4 fingers of our hands, 4 fingers of
Ang
our
color
hands
is sufficient
held together because we will be palpating gently the pulsation. So we're going to follow the 8 to 9. So first we're going to palpate we're going to follow the 8 to 9 so we will not forget any areas that we will not be to palpate. So first we're going
I
to
was
palpate the areas.
able to detect no abnormalities in the feet and toes and the legs. So there are no extremities. Now let's proceed to testing the pitting edema of the patient. To give you a background of the pitting
In
edema,
palpating the
pitting
material, we're
edema
going
is
to
four
look for
grades.
its apical impulse.
Grade 1, 2, 3, 4, having 2 millimeters of parameter, which is 2, 4, 6, 8. We're going to be assessing for testing the pitting edema by gently pressing our index finger on the pre-tibial area of the patient and to check if there are any
And then overall, we're going
indentation
to check for the size and the
leaving our
duration,
upon moving away our finger from the pre-tibial area. So,
Next is we're going to also using the diaphragm to hear the high pitch sound. So in oscillation, we're still going to follow
the skin is able to recoil back to its original state left for less than 3 seconds, which means that the patient is now elevated. The grade 1 edema, leaves the skin allows the skin to recoil for 3 to 5 seconds, the grade 2 being less than 15 seconds, the grade 3 being less than 30 seconds, and then the for which is more than 30
So I
seconds.
have not heard any abnormalities
So
or
the last
perception
step,
or
which
murmurs
is
or
now
anything.
to
So the patient is normal. Next, we're going to assess
and
the
check the pulse and temperature of the
the
patient's
peripheral
vascular
vascular system. So first, we're going to assess the upper
We're gonna be using
so
the
assessing the upper
hands,
we have to ask the patient to sit
or
down
one
or in
for
sitting
the
position. And we're going to inspect for lesions, rashes, and abscess.
There's a central venous pressure.
After that, if present, we're going to palpate it. If there are any masses, lesions, or rash, we have to palpate them using our clean hands. Or if possible, no. If lesions, we have to wear gloves
Okay. Now let's move to the
to avoid any infection. Next is to palpate the radial and the brachial artery. Why do we have to palpate? This is to know
now I was able to test all the pulses from the posterior tibia and the dorsalis pelvis. Now that we're done with assessing both the cardiovascular system and the peripheral vascular system,
Next is we're going to assess
the patient to a comfortable
So
position.
ma'am, we have to ask the patient again to lay down or position the patient in
And
a
then we're going to
position.
perform hand hygiene.
Next is we're going to assess the So first, we're going to inspect for any lesions, the hair growth, the nail growth, for edema, varicosities, and more. Next is to palpate the peritibial area for edema. So there are 4 grades. We have the grade 1. If we palpate the peritibial area and then there's a dent, or the shape of the shape after you press the peritibial area won't go to its normal shape, there's a edema present. So grade 1 if 3 to 5 seconds, grade 2 for 15 seconds, grade 3 if 30 seconds, and grade 4 for more than a minute. After palpating the edema, we're going to palpate for the skin temperature and the pulse. So first, we're going to palpate the posterior tibia. For this area, posterior tibia, the dorsalis pedis, and then last is the popliteal area. So these areas are where you can hear better or feel better the pulse or the pulse, because these are the places where you can see or located where the arteries are located. And lastly, we're going to after that is we're going to perform hand hygiene. Perform hand hygiene. I ask the patient if position the patient in a comfortable position. So perform hand hygiene and